Welcome to Mind Your Mental Health channel. As the name suggests, this channel is going to talk about mind, mental health, mental illnesses, treatment, other various mental health related topics. We have chosen to launch it today on 10th of October for a reason. 10th of October every year is observed as a World Mental Health Day all over the world. Every year there is a theme to observe, and this year's theme is mental health and work. And this is our first episode of the channel, and this is going to be an introductory episode. We are going to discuss, or we're going to tell you what we intend to do and who we are. Now, our background, what is it? So let me tell you what we intend to do. We have some experience in channel relating to mental health. About 5 years ago, October 10th, that's also a mental health day, World Mental Health Day, we launched a similar channel, Mind Your Mental Health, in a different language. We launched it in Tamil language. Tamil language is one of the Indian language spoken in the southern part of India, a state called Tamil Nadu. Capital of that state is Chennai. It used to be called as Madras. In United Kingdom, if you go to Indian restaurant, on the menu card you will see a Madras curry. That's the place I come from. So we are from Madras. We relocated in 2004. We'll talk about it a little later. Let me focus on the content, what we are going to do in this channel. So in the Tamil channel, it's called Manasai Gavani. That's a Tamil word. And what it means is mind your mental health. So we have done so far 127 episodes on various topics in mental health. We talked about, there are about 10 episodes we've done on mind alone. What is mind? How does it work? All those things, the concepts of mind. Then another 40 or 50 episodes on mental illnesses. And another around 20 episodes on psychosexual dysfunctions, and another 20 episodes on alcohol and drug, and also about 20 episodes on marriage, marital harmony, all those things. So far we have completed 127. We are still going, so we will be continuing that. There are many more topics to discuss. So we are replicating that work in English for our English audience. So what we intend to do is initially talk about mind, explain to you about the mind as far as possible in a simple English, without using much of a jargon, and also without quoting many names. So it's going to be a subject. Content will be explaining about what is mind and what we have learned so far. And today being the first episode, we are introducing about the channel. So I've told you what is going to be the content of the channel. Next, let me tell you who we are. I mean, why we are doing this. What is our background? What is the qualification we have to talk about mental health? I am a doctor and I am a psychiatrist. I am a consultant psychiatrist in NHS. I relocated to UK, United Kingdom, southern part of the UK, in year 2004, when there was a huge recruitment crisis in NHS. There was a dearth of consultant psychiatrists. So there was a program where they reached out to the world, invited whoever has experience, skills, they can come and contribute to the NHS workforce. So we responded to that. We relocated in 2004 to United Kingdom. We are a family of four persons. We are a small family. My wife, 2 daughters. We are 4 of us in the family. Let me tell you each of us background. I started my psychiatric training in India in the year 1981, and I put in about 25 years of service in Chennai, India. As a training, then as a higher training, I did my DPM, then I did my MD psychiatry, then went on to government services, health services, and then worked as a tutor, assistant professor, and professor. So we relocated as a family. There's a reason for that. My wife, Dr. Mallika Sundaram, is also a psychiatrist. We both of us worked in an institute, a great institute called Institute of Mental Health. Actually, it was established by British, and I think in 1774, if I'm right. So it's a very ancient institute. It started as a mental hospital, then converted to institute. And when I left the institute, they had about 1,800 bedded. It's a huge complex with 1,800 bedded. That's where we trained. And we were attached to Sandy Medical College and then on to Madras Medical College. So towards the end of my career in India, I retired as a professor of psychiatry from one of the medical colleges. So that's my background. And my wife also studied the same institute. Both of her were in the same institute. And she did her MD, psychiatry and DPM. And she relocated when she was assistant professor, Institute of Mental Health. So 2004, we relocated with our two daughters because both of us psychiatrists. So we said, let's move as a family. So both of us joined NHS. So both of us worked in NHS from 2004 to 2019. 2019, I took retirement. Both of us took retirement after 20 years of, after 15 years of service. And then I still go back and help out the trust. I mean, I do go back, work for a few months when I'm available because the crisis still continues, recruiting crisis still continues. There hasn't changed much, if not it's become worse. So that is our background, myself and my wife. I have two daughters, I said. Elder daughter name is Sudha Soundararajan. She completed her higher training in psychiatry. She's a psychiatrist, yes. And she specialized in general adult psychiatry and de-addiction, alcohol and drug, substance misuse services. And she's planning to join as a consultant psychiatrist in NHS very soon, probably. And my youngest daughter is Vinita Soundararajan. She is also a psychiatrist, Dr. Vinita Soundararajan. She completed the basic training, 3 years of psychiatric training, and then secured a Master Psych qualification. She is a psychiatrist. Now she has gone on to the higher training. She is trying to specialize in general adult psychiatry and also psychotherapy. So she'll be doing this higher training for next 5 years. Then she'll become a consultant. That is our background. So 4 in the family, all the 4 are psychiatrists. That looks a bit unique. So imagine, I mean, when we meet somebody, some new person somewhere, and as a family, we introduce ourselves. I'm Soundararajan. I'm a psychiatrist. They say, okay, yeah, nice to meet a psychiatrist. Then my wife steps in and says, I'm Mallika, I'm also a psychiatrist. Oh, okay. Oh, it's nice. Then my elder daughter steps in and says, Uncle, I'm also a psychiatrist. Then they may not respond. Then my last daughter, Vinita, steps in and says, I am also a psychiatrist. You can imagine. But things have changed now. Compared to what it was 40 years ago when I joined 45 years ago when I joined the psychiatric training, we have come a long way in destigmatizing the mental health and mental illnesses. Thanks to the number of professionals now, psychiatrists, psychologists, psychiatric nurses, social worker, allied professionals, they've contributed to the awareness and lots of other things now, the media and especially social media, TikTok, Facebook, Twitter and Instagram, all those things do have wide range of information on mental health. But I should also caution you, there are also material which is not that good is available on social media. That is also one of the reasons what we thought is, as a professional, we need to do this. So we need to talk about it. And we already done it in Tamil language. I thought, okay, let's do it for the English language also. So that's the purpose of this YouTube channel. As the title says, Mind Your Mental Health. We are going to talk about different aspects of the mental health. And this is the first episode. From next episode, we are going to talk about mind. And different aspects. Probably it will go on about 8 to 10 episodes talking about mind alone. So as I said, we will try to make it as simple as possible. And next episode will be about mind introduction. Now, to give you an overview, kind of a brief overview about why we are talking about mind, why mind is so important. You already know. We are just going to kind of summarize. Not that you don't know. Everybody knows about mind in different levels. So this channel will address different audience. Now, people who do not know anything about, who haven't known anything about mind, or people who have known about mind. So we are trying to balance the content in such a way that the person who did not know anything about mind also benefits from this YouTube channel. So thank you for watching this channel, this episode. And next episode will be on mind and introduction. See you all at the next episode. Keep watching. If you like it, subscribe it, and you can also tick the notification button so that you get notified when we publish the episode. And also we will be uploading episodes on a weekly basis, most probably during the weekends, so that you have weekend to watch these episodes. And as we go along, we might do it more frequently, but initially it's going to be weekly, most probably weekends. Take care. Bye. See you in the next episode.